Hello and welcome to Cells4Life's webinar celebrating the last day of Cord Blood Awareness Month. My name is Claudia Rees and I'm being joined by Cells4Life's Chief Scientific Officer, Dr. Leslie Ann Martin.
Hello.
We thought during these unprecedented times, and in particular with the impact that COVID-19 is having on pregnancy and birth, it would be useful to go through what exactly is going on, in particular in relation to cord blood banking, and on a more positive note, cover some of the amazing things that stem cells are being looked at for the treatment of COVID-19. But before we get to that, I'm going to start off, for those of you that don't know so much about cord blood banking, by asking, what is cord blood banking?
So to begin with, cord blood is the leftover blood in the cord and placenta. It's an amazingly rich source of stem cells. But what I'd also like to say is it's not just cord blood that's the rich source of stem cells, it's also the umbilical cord itself as well as the placenta. So cord blood banking and the tissue banking that goes along with it is the preservation of the tissue with the stem cells using cryotechnology. And this is where we freeze at very low temperatures, and that allows us to freeze it for many, many years with the chance of using these stem cells for regenerative medicine in the future.
And what can these cells do in these different tissues? What are they going to be used for?
I think that the field of regenerative medicine is amazingly exciting, and as a parent myself, I stored down my daughter's stem cells, and in fact she was, of course, donor number one for Cells4Life. And as soon as we'd stored down her stem cells, many of our friends who were clinicians and scientists also wanted that opportunity. In the field of regenerative medicine, stem cells can be used for the treatment of inoperable heart disease, for instance, osteoarthritis, diabetes. These are all conditions that an aging population is going to experience. And for me, the possibility that her cells could be used to treat her in later life was an opportunity that I didn't want to miss. And as you've seen, the field, as you said, moving into treatment of COVID with stem cells, this is limitless, and it's something that I think is a once-in-a-lifetime opportunity.
Fantastic. We're now going to move on to talking a little bit more about COVID-19 and its impact. But before we do, I just want to say, if you check out the comments section, we have linked to our COVID-19 and pregnancy download. This covers a lot of what we're about to talk about, so if you don't have time to watch the whole webinar, do make sure you go and download that, and you can read much more about it. So to get started, a lot of pregnant women are going to be worried about the impact that COVID-19 will have on them. Just for a bit of reassurance, are they more at risk?
So no, the studies so far have shown that they're not more at risk. The reason that women are put on these medium at-risk lists by the government and the NHS is because we have to be cautious. During pregnancy, a woman does suppress her immune system, and there is some evidence that women who are pregnant that experience influenza have more severe symptoms than, say, somebody in the public. But there is no evidence to suggest that that's the case with COVID-19. These are just precautionary issues, as they should be. You know, pregnancy is a very important part of a woman's life.
Of course. And sort of moving on to thinking about mum, what about baby? If mum has COVID-19 or she thinks she might have been exposed to it, what are the risks to the baby? Could she pass it on to her baby?
That's a really interesting question, Claudia, and I think that a lot of this has stemmed around a study from Wuhan, where I believe there were 30 mothers that had COVID-19, and in 3 cases the babies were diagnosed after birth with COVID-19. They all recovered, and obviously symptoms in younger people are far less severe. However, in a much larger study that was conducted in New York, where they had 120 mothers with COVID-19, none of the infants were shown to have a COVID-19 infection after birth. And most importantly, 2 weeks later, after they've been at home with mum and breastfeeding, again, none of them showed any symptoms of COVID-19. And in fact, the World Health Organization has now put out a statement which says that it's more important for the baby to be in contact with the mother and to be breastfed, and the risk of them not doing that is greater than that child actually contracting COVID-19. And what you'll see in the hospitals now is that in the maternity suites, the midwives, etc., and the birthing team are all wearing PPE, and the conditions are particularly rigorous, so that there is limited chance of any transmission to the child during the birthing process.
That's really reassuring.
It is.
What about the cord blood itself? Could that contain COVID-19?
Oh, another very interesting question. So when we look at COVID-19, so this is a coronavirus SARS-2, it's a respiratory virus. So we know that respiratory viruses themselves aren't actually in the blood. It's in very limited circumstances. With influenza, you may see very, very low levels of the virus in the blood. Mm-hmm. What we see is actually antibodies to the virus in the blood. So will the COVID-19 be in the cord blood? No. Mm-hmm. And I think proof of that comes from the FDA again, who has said that for all of their donor programs, they don't require the COVID-19 testing for those patients that are asymptomatic as donors.
Yeah. Fascinating. And what about the good news? I've heard a lot and I've seen a lot that stem cells from perinatal tissues, so cord blood, cord tissue, and the placenta as well, are showing some really promising early results for the treatment of COVID-19. Can you tell us a bit more about that?
Absolutely. So this is a really big area at the moment. So just to say that the stem cells aren't being used to treat the virus, they're being used to treat the symptoms of the virus. So if we just go back a few steps, in some patients that contract COVID-19 or SARS-2, the virus goes to the lung, and there obviously it causes inflammation, and that's a natural process for our immune system. And this inflammation is caused by small proteins called cytokines, and they signal to the immune cells that we have a pathogen there that needs to be got rid of. But in some patients, those cytokines, which are meant to be orchestrating a controlled response to the virus, go out of control. And what we get is a cytokine storm. And this is particularly dangerous because what it does is, not only does it attack the virus, but it now starts to attack the lung tissue. And in those patients that have these inflammatory cytokine storms, the lung almost looks like glass. So what's been proposed is that mesenchymal stem cells, which have this ability to damp down the immune system, may be suitable for treatment in those patients. So what mesenchymal stem cells do is send out signals that bring in a different type of immune cell that says, hang on, let's just calm down a bit, let's just attack the virus. And so there was a beautiful study that was conducted in Israel using mesenchymal stem cells from placental tissue, actually. They treated 7 patients who had very severe COVID-19 symptoms, and they showed complete recovery in 4 of them. And then 3 of them were taken off of respirators. But the most interesting thing in this study, we should point out it's a phase 1, and this is anecdotal evidence, but 3 of those patients showed repair of lung tissue, which again is something that mesenchymal stem cells are known to do. They can form any type of tissue. And then another study in Australia is also looking at cord blood as a source of mesenchymal stem cells, and there was a very nice paper put into one of the Lancet associated journals, again showing that mesenchymal stem cells were able to damp down this severe inflammatory response. And then lastly, and I think most exciting, of course, is the FDA's new directive. So the FDA are now supporting the use of mesenchymal stem cells from umbilical cord tissue this time for the treatment of patients with COVID-19. And they've put together a task force which is being led by Miami University to put mesenchymal stem cells into various phase 2, phase 3 trials, because that's what we need. And I think we're going to find that for compassionate use, mesenchymal stem cells are going to be very useful for treatment of COVID-19.
Wow, that's fascinating. So it sounds like they're not actually targeting the virus, but they are potentially able to ameliorate some of the symptoms that make the virus so dangerous.
Exactly. That's what they're hoping, and also the fact that they can heal, because obviously they have this healing capacity, the lung tissue as well.
Wow. Okay. So it sounds like there's a really compelling reason to do this,
Yes.
and maybe particularly now.
Yes.
But what about the process itself? Is it still possible to bank stem cells during COVID-19, and how do we go about doing this?
That's an excellent question. So at the height of the pandemic, we found that hospitals were naturally restricting the number of people that were going into the maternity suites. And we've used phlebotomists to collect cord blood and cord tissue and placenta. Now, the collection of placenta is unique to Cells4Life.
Yeah.
It's one of our new options. We feel very strongly that the placenta has not only a high level of stem cells in it, but of course placental tissue like amniotic membrane, for instance, has been used since the 1930s for treatment of burns, burns in the eye, for instance, and more recently populations of natural killer cells within the placenta have been identified, and these can be extracted from frozen tissue, and they've been shown to target cancer cells. And there's a big drive now to look at some of the immune components within the placenta. So at Cells4Life, we're obviously with our new ability to bank down placenta, that obviously becomes an arena that parents could investigate. So back to the impact of COVID-19 in the hospitals. Whilst we have seen that phlebotomists have had restricted entry at the peak of the pandemic, we have been able to sign agreements with hospitals which have allowed us to procure the placenta and umbilical cord, and that allows us again to have a very rich resource of stem cells available. But now, of course, as the hospitals are opening up, our phlebotomists are now beginning to gain access again, and the standard process can take place. But for customers that are concerned that their maternity wing may not, or the hospital may not accommodate a phlebotomist, then our sales reps are happy to speak to the customers and also the hospitals in order to put in place these agreements that will allow the midwives to take the placental tissue. And again, that's a unique facet of Cells4Life.
I think it's been really timely for us actually, the placenta launch, because it is such a simple collection procedure in these few cases where the hospital has not been willing to let in a phlebotomist. It's such a simple procedure that the hospital is happy to take that on themselves. We just sign an agreement with them, and then it can all go ahead as normal.
And also, of course, at Cells4Life, we've put in place various contingencies, because we do believe that you need to process the tissue as quickly as possible, keep those viabilities high. You know, the higher the number of cells, the better the chance of a good take in any sort of medicinal arena that they'd want to be used in. And so what we've put into Cells4Life with our 24-hour laboratory is a shift pattern for our scientific technicians. So these people are qualified in processing of the tissue and the cord blood for storage. We've put in rota systems where they don't come into contact with each other, and so our laboratories remain open 24/7. And I think this is so important.
That you can have not interrupt.
Absolutely.
Yeah, definitely. So I think hopefully it's sort of self-evident from what we've been discussing about what stem cells have been doing.
Yes.
But why do you think it's particularly important for parents to be doing this now?
Well, for me, it's a once in a lifetime opportunity, and as I said, this was something that I wanted for my children. I think that in the future, the arena of regenerative medicine, we're seeing the ability to generate heart cells for the treatment of osteoarthritis. And even now, the generation of organoids from stem cells that can be used for drug therapies. We can test the drugs and decide which drugs are going to be best for you for treatment. We can test how your cells will respond to particular portfolios of drugs. This is an autologous thing that we can offer. That means for the child itself.
Mhm.
So you know that there's also allogeneic therapies where you can take stem cells from other sources and they can be used for therapies, but they're not genetically matched. So for drug testing, for instance, that would be a problem. You really need them to be autologous and your own. And then who wouldn't want to give their child the opportunity to use their own stem cells for regenerative medicine? So, as I said, there's a big foray now into the treatment of inoperable cardiovascular disease and the generation of organs. I'm sure we've all seen some of the amazing work that's going on.
Yeah.
That will require autologous transplant as well, genetically matched.
Yeah. Fascinating. This has been really interesting, and I hope it's been helpful for you guys as well. Don't forget to go and download our COVID-19 and pregnancy booklet by following the link in the comments section. It covers pretty much everything that we've discussed, plus a bit more, so it's a really useful resource. Thank you so much for joining us today to celebrate Cord Blood Awareness Month. Do take care. Thank you.
Thank you.